Good morning, Ma'am Sir. I'm Michael Guevara from BSN 212E. So today I will perform the return demonstration for catheterization. So catheterization is the insertion of a catheter into a patient's bladder to drain urine from the bladder into an attached bag of container. The purpose of this is to relieve acute or chronic urinary retention. Also, this is to determine the amount of residual urine after voiding. So first is to check the doctor's order for the catheterization. Next is to wash hands before preparing the set to reduce microorganisms that causes disease and contamination. Since I have already done washing my hands, I will sanitize my hands using alcohol. Next is to identify patient and explain the procedure. The patient will feel reassured if the procedure is explained and she is handled gently and considerately. So, good morning, ma'am. I'm Michael Guevara, your student nurse for today. May I know your name, your age, and your birthday? So, ma'am, today I will do the catheterization, which means that I will be exposing the private area. Is it okay, ma'am? Also, I will insert the catheter, ma'am, for you to be able to release the urine. Now, after that, provide privacy by screening or closing the room and position patient in a dorsal recumbent with the knees flex. Good visualization of the if the needs is essential to introduce the catheter. So, I'll close the door at the curtain and the door. And now I will position the patient in lying position with knees flexed and wide leg open. After that, drape the patient, exposing only the area to be used. So embarrassment and chilliness will make the client to become tense and tension. So, expose only the area. Okay, so apply direct light for visualization of genital area may interface with the easy introduction of the catheter. So assume that the light is indirect to the genitalia. Now, open the tray and arrange equipment for convenience and accordingly to avoid contamination of sterile items. Placing the equipment in order will increase speed of performance. Reaching over sterile items increases risk of contamination. So we'll open the tray. So, using the sterile forceps, cleanse the area using cotton ball with betadine. Thorough cleansing of the meatus and the area surrounding it reduces possible introduction of microorganisms in the bladder. So, using the sterile forceps, we'll cleanse the meatus. And on the other side, as well as on the other side. Okay, so now open the set observing sterile technique. After that, put on the sterile gloves. So now I'm done donning my sterile gloves. Now after that, put the eye sheet. So after that is to lubricate the catheter for about 1.5 inches, being careful not to plug the eye of the catheter. So I will lubricate. So pick up the catheter at least 3 inches from the top to the top. Place the thumb and one finger of the left or right hand between the labia minora and separate and pull up gently, separating the area surrounding the meatus provides visibility to about 1.5 inches. So now insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. Female urethra is approximately 1.5 inches. So I will insert the urethra with labia. insert for about approximately of 1.5 inch. Okay, so if the specimen is to be collected, pinch the catheter with the thumb and finger while placing the specimen container in position. Now, rest the hand in the pubis area while holding the catheter in place to prevent pulling and pushing of the catheter. Withdrawing the catheter and pushing it back in the urethra increases the possibility of contamination to the urethra. Now, after that is to connect the catheter to the urine bag. Now, inflate the balloon 10-15 cc of sterile water using 15 to 20 cc syringe. Now secure the in-body catheter by taping it to the patient's thigh. Allow some slack of the tubing to accumulate the patient's movement. Now I will tape the bag beside the patient. After that, place the patient comfortably and do the aftercare. So now I will cover the genitalia area. After that, record the time of procedure done, and the amount and the color of the initial output. So I will dispose my gloves and discard it to the receptacle and perform hand hygiene. After that is to document all the data that was collected. So, ma'am, thank you for your cooperation. I have already put your catheter. So, that's all. Thank you for